Good morning, everyone. My name is Tammy Anderson, and I'm a professor in the Department of Sociology and Criminal Justice. I'm also the Associate Director of the Center for Drug and Health Studies, and I've been at the university since 2000. And I understand that you are young investigators here at UD and at other ACEL affiliated programs. I think that's correct. So welcome, and I am excited that you're interested in opioid research, which is what I'm going to talk to you about today, but also other substance abuse and behavioral health research I'm involved with, and the HEN app, Help Near Now, also has as its purview primarily substance abuse, but also we are scaling it to mental health. So let me start by saying a few things to you about the HEN app and sort of where it fits in my life. I have been studying various substance use problems for many years, and this is probably my fifth epidemic that I've been involved with. And for the first time, I've been able to really do community engagement research. And that is featured here with this HEN app. It's featured collaboration across the university with engineers that I never worked with before, and data scientists in bioinformatics that I also never worked with before. And everybody is really highly motivated to this project. And with the interdisciplinary team we have here on campus for HEN, we are also working with so many state partners here in Delaware, and we're branching out to Pennsylvania, Jersey, and Maryland, the region as well. So there are some lessons here that I've learned late and opportunities I've learned later in my career. I hope you can learn from and capitalize on at the beginnings of your career. So HEN, Help Near Now, is, as the slide shows, a GIS or location-based interactive platform on a smartphone app, both iPhone and Android, to connect people and their families and care providers also to services that people need for substance use disorders. And what it does is it also, so when you see the phone there, it has four categories of services: prevention and education, health resources, treatment, and recovery support. So when you click on the button, I don't have it webcasted right now, you can get a listing of all these services that are available in the state of Delaware, and then you can also get directions and website information and phone number information right there when you click on it. You can also create a login ID that is private to allow you to rate and comment on the services. You can share the services, you can filter them to fit your needs, your demographic needs, your geographic needs, etc. And then down here at the bottom is one thing that we're learning is really unique about HEN, which is listing the community events that all of the service providers listed in these four tiles offer. So you can find partial directories of these services elsewhere, but they're not on an app, so that's one advantage. But the events is something you really can't find centrally elsewhere. So that really stands out on our app. You can find things, for example, in health resources like the overdose prevention drug Narcan, as well as training, where training sessions in events are going to be held to teach people how to use it. Syringe exchange programs, as well as where will the syringe exchange trucks be? That would be listed under events. To get to the HEN app, it required a collaboration between my team and 2 graduate students who know the substance and content and expertise in substance abuse, to work with the engineers who could program the app, and then also the data analysts, the data analytics that lie behind the app, which can analyze the number of clicks, help us populate the app with new information, and then run reports and analyses on how the app is being used. We also have an industry partner that we've been working with from the beginning, Green Line Business Group, right here in Newark, a health tech company. So what we have developed is a health tech tool for people to get the help they need. It also serves as a tool for care providers, doctors, nurses, probation officers, everybody that works with those who are suffering from a substance use disorder, to get the help, to get their clients and patients the help they need. So even the person manning the hotline can pull HEN up, and then based on the caller's characteristics and needs, can set the filters on HEN and then help them, point them to the direction of what services they might want to have. As you can see, we all know the opioid problem is our leading substance abuse problem. It's also beginning to change back with other drugs. Cocaine is surging right now. Prescription opioids are still a problem, but illegal opioids like heroin and fentanyl are causing more of the deaths these days. Delaware, unfortunately, the state we're working in, ranks very high. So despite all of the solutions from legislation to healthcare and education and training that are being done here in the state recently, we're still suffering from an overdose problem. The rates are continuing to escalate. And so you can see we have the 9th highest overdose death rate in the state. And so HEN becomes a solution because it will improve access to those services. The last thing I want to say about HEN, and I want to show you who my team leaders are. So Dr. Hui Fang is the team leader from computer engineering. She supervises the grad students. By the way, grad students built this app, which we're very proud of. And then Kathy Wu supervises the data analytics part of it. She also runs the Data Science Institute and is chair of bioinformatics and computational biology. We have plans to scale this app regionally. As I've said, we've already gone to the Delaware region in PA, Jersey, and Maryland, and we are in the process of scaling it to mental health. But I think we're going to pause there and just work on quality control and improvements to the app's functionality. So that's what I have to share about the HEN app. Are there any questions or comments?